Hello, it's nice to greet you. Does your dog or cat seem perfectly healthy? They eat well, play with you, and run all over the house. So, does that mean they can't transmit any diseases? The answer might surprise you. Some pets can carry microorganisms capable of affecting other animals and even people without showing any visible symptoms. This phenomenon is known as being a silent carrier, and it's much more common than many owners imagine. In this video, you'll discover how it happens, what the most frequent diseases are, and what you can do to protect your whole family while still enjoying your furry friend. What does it mean to be a silent carrier? When we think of a sick pet, we usually imagine a lethargic dog with a fever, cough, or lack of appetite. But the reality is different. Many microorganisms can live temporarily inside an animal's body without causing any obvious problems. Meanwhile, that dog or cat can shed viruses, bacteria, or parasites through saliva, feces, urine, or even through direct contact. In other words, it appears completely healthy, but is still capable of transmitting certain diseases. Why does this happen? The immune system of some animals manages to control certain microorganisms without completely eliminating them. This means that the infectious agent remains present without causing symptoms. In other cases, the pet is in what is called the incubation period. During this stage, the microorganism is already multiplying and can begin to spread before the first clinical signs appear. It is precisely this period that allows many diseases to spread easily. Diseases that can be transmitted before symptoms appear. One of the best-known examples is canine influenza. Many dogs can infect other animals several days before they start coughing. In cats, something similar occurs with some respiratory infections, where the virus can be shed even before sneezing or nasal discharge appears. There are also bacteria like Salmonella, which some dogs and cats can carry without getting sick, but which pose a risk, especially to young children, the elderly, and people with weakened immune systems. Another important case involves certain intestinal parasites. Some animals shed microscopic eggs in their feces while appearing perfectly healthy. Who is most at risk? Not everyone reacts the same way to these microorganisms. The most vulnerable groups include young children, the elderly, pregnant women, people with illnesses that affect the immune system. This doesn't mean they should avoid living with pets. They simply need to maintain better hygiene practices and have regular veterinary checkups. How to reduce the risk? The good news is that preventing these infections is usually simple. Take your pet for regular veterinary checkups. Keep vaccinations and deworming schedules up to date. Pick up feces immediately. Wash your hands after cleaning the litter box or picking up excrement. Prevent your pet from licking wounds, eyes, or people's mouths. And if a new animal arrives in the home, make sure to have a veterinary checkup before allowing contact with other pets. These measures greatly reduce the risk of transmission. Should you be worried? No. The vast majority of dogs and cats live their entire lives with their families without causing any problems. The goal is not to create fear. The real message is that a seemingly healthy pet is not always completely free of microorganisms. That's why prevention and preventative veterinary medicine are so important. Conclusion: your pet may look perfectly healthy and still be shedding some microorganisms temporarily. This doesn't mean you should distance yourself from your pet, but rather that you should prioritize prevention, veterinary checkups, and good hygiene at home. Caring for your dog or cat also means protecting the health of your entire family. If you found this video helpful, please like, subscribe to the channel, and share it with other animal lovers. Every small preventative habit can make a big difference in keeping people and their pets healthy.